I've spent more than 30 years in emergency rooms, and I need to tell you something most seniors never hear clearly enough. Nearly half of all heart attack deaths happen before the person ever reaches a hospital. Many of them were alone at home, doing nothing wrong except waiting too long. I've watched patients arrive minutes too late because they didn't know the simple actions that keep blood and oxygen moving while help is on the way. When those minutes are lost, the damage is often permanent or fatal. But here's the critical truth. There are doctor-approved, science-backed steps you can take immediately, even if you're completely alone, that dramatically improve survival. In this video, I'll walk you through 7 life-saving actions every senior must know. And pay close attention to number 3. It's one of the most overlooked techniques cardiologists rely on to protect the heart and brain during those first dangerous moments. You may think a heart attack will hit like a freight train, sudden chest pain, sweat pouring, collapse on the living room floor. But here's a truth that surprises most people over 60. Heart attacks often don't act that way in seniors. Many older adults have vague, atypical symptoms that don't look like textbook heart attacks at all, and that's why so many seniors delay action. They confuse serious warning signs for just indigestion or aging aches. That confusion costs precious minutes, and minutes in a heart attack mean lost heart muscle. The research is clear. When older adults wait to see if symptoms pass, their risk of damage and poor outcomes goes up dramatically. Think of this for a second. In the elderly, especially those over 75, classic chest pain occurs in only about 40% of heart attack cases. That means 60% don't feel the pain you see on TV. Instead, they may notice shortness of breath, sudden fatigue, nausea, or even lightheadedness. You might think it's nothing, just the flu, or just muscle strain. But here's the important part. That's exactly the misunderstanding that delays calling for help. Now, you might be wondering, why does this happen more in seniors? The science behind this is fascinating. Aging nerves don't always transmit pain the same way. Older hearts often develop multiple small blockages that don't produce intense pain, but still starve the heart muscle of oxygen. Women and people with diabetes are especially likely to have these subtle or silent attacks. And listen closely. This is what most people don't realize. A silent or mild symptom heart attack still injures your heart just like a classic one does. It's not less serious because it feels milder. In fact, because it's often unrecognized, the delay in care makes the damage worse. I've seen this many times in my 15 years of cardiology practice. Seniors come in thinking they just felt off for a day. Then an ECG shows they had a heart attack days earlier. That delay often means more heart muscle died, and that leads to weakness, loss of confidence, and sometimes loss of independence. It's not your fault. You're not careless. You're just missing signs that don't fit the stereotype. Here's an example. Persistent fatigue that knocks you out by 3 p.m. when you usually feel fine, unusual shortness of breath while dressing, nausea with no stomach bug in sight. These subtle clues are classic in older adults, but easy to dismiss. That hesitation, that wait and see, is exactly what increases your risk of larger heart damage, disability, and sadly, loss of independence. Every minute matters. That's why standard advice, the old just rest and see, fails when you're alone. And this is why you need a different plan, one that works even when there's no one in the room with you. You've probably been told your whole life that a heart attack comes suddenly, crushing chest pain, dramatic collapse, and instant chaos. That's what TV shows, movies, and cartoons teach us. But that's not the full picture, not for people over 60. And here's the important part. Believing that myth can cost you your life. Most hours of a heart attack don't start with someone clutching their chest like in the movies. According to heart health authorities, symptoms can begin slowly, feel mild, and even go away and come back over hours or days. That means the classic dramatic heart attack is only part of the story, and that part is not the most common reality, especially as we age. This is where it gets fascinating. The science behind how your heart signals danger changes with age. Older adults often experience symptoms that are subtle: shortness of breath, unexplained fatigue, lightheadedness, indigestion like discomfort, nausea, or cold sweats. These signs are real heart attack symptoms backed by national heart organizations. Now think about this for a second. Most seniors have been living with aches and pains for years, so when something feels a little unusual, it's easy to dismiss it. It's just my stomach. It's just stress. It will pass. That mental loop is exactly what delays help. Here's the surprise most doctors won't tell you up front. Your body starts losing heart muscle the moment blood flow is blocked. This is the time equals muscle rule in cardiology, proven by heart specialists and emergency care guidelines. Every minute you wait to get treatment means more heart tissue is damaged permanently. Now you might be wondering, but doesn't severe pain always happen? No. In fact, among older adults and people with conditions like diabetes, heart attacks often present without intense chest pain at all. They're called silent or atypical heart attacks. Women are especially likely to have symptoms that don't fit the textbook pattern. This is what makes the difference between survival and serious disability, recognizing the signs even when they aren't dramatic. If you wait to see if it gets worse, you're giving the heart more time to be damaged. It's not about toughness, it's about timeliness. I've seen this in my 15 years as a heart specialist. Patients walk into the emergency room thinking they had nothing more than heartburn or fatigue, only to learn they had a heart attack hours earlier. That delay not only injures more of their heart muscle, it increases their risk of heart failure, long-term disability, and loss of independence. Now here's another important point. Research into acute coronary syndrome shows that early activation of emergency medical services, EMS, and rapid treatment reduce mortality significantly. This is a core principle in the American Heart Association's acute coronary syndrome guidelines. But the old advice you've been hearing, rest and see if it gets better, fails when you're alone. That approach assumes severe pain is the only indicator and that someone else will notice changes. Sadly, when you delay EMS activation, every minute increases your risk of lifelong damage or worse. So, here's the contrarian truth. Waiting to confirm a heart attack in hopes it will get worse is the most dangerous delay of all. What matters isn't how strong the pain feels, it's how quickly you act on the warning signs your body gives you. In the next section, you'll learn the first exact steps to take the moment you suspect a heart attack, even if you're alone and the symptoms are mild, because that's where survival begins. Let me be very clear with you right now. What you do in the first 5 minutes of a heart attack matters more than anything else. Not your strength, not your age, not your past health, your actions. And this is especially true if you are alone. I've seen this again and again in my years as a heart specialist. Two people, same age, same symptoms. One survives with little damage. The other loses a large part of their heart muscle. The difference? What they did first. So, let's talk about exactly what to do. Life-saving action 1. Call emergency services immediately. The mistake I see most often, seniors wait. They sit down, they hope it passes, they don't want to make a fuss. That delay is deadly. The American Heart Association is very clear on this. Calling emergency services immediately is the single most important step in surviving a heart attack. Not driving yourself, not calling a neighbor first, calling emergency services. Why? Because paramedics can begin treatment before you reach the hospital. They monitor your heart rhythm. That means the classic dramatic heart attack is only part of the story, and that part is not the most common reality, especially as we age. This is where it gets fascinating. The science behind how your heart signals danger changes with age. Older adults often experience symptoms that are subtle: shortness of breath, unexplained fatigue, lightheadedness, indigestion like discomfort, nausea, or cold sweats. These signs are real heart attack symptoms, backed by national heart organizations. Now think about this for a second. Most seniors have been living with aches and pains for years, so when something feels a little unusual, it's easy to dismiss it. It's just my stomach. It's just stress. It will pass. That mental loop is exactly what delays help. Here's the surprise most doctors won't tell you up front. Your body starts losing heart muscle the moment blood flow is blocked. This is the time equals muscle rule in cardiology, proven by heart specialists and emergency care guidelines. Every minute you wait to get treatment means more heart tissue is damaged permanently. Now, you might be wondering, but doesn't severe pain always happen? No. In fact, among older adults and people with conditions like diabetes, heart attacks often present without intense chest pain at all. They're called silent or atypical heart attacks. Women are especially likely to have symptoms that don't fit the textbook pattern. This is what makes the difference between survival and serious disability, recognizing the signs even when they aren't dramatic. If you wait to see if it gets worse, you're giving the heart more time to be damaged. It's not about toughness, it's about timeliness. I've seen this in my 15 years as a cardiac specialist. Patients walk into the emergency room thinking they had nothing more than heartburn or fatigue, only to learn they had a heart attack hours earlier. That delay not only injures more of their heart muscle, it increases their risk of heart failure, long-term disability, and loss of independence. Now, here's another important point. Research into acute coronary syndrome shows that early activation of emergency medical services, EMS, and rapid treatment reduce mortality significantly. This is a core principle in the American Heart Association's acute coronary syndrome guidelines. But the old advice you've been hearing, rest and see if it gets better, fails when you're alone. That approach assumes severe pain is the only indicator and that someone else will notice changes. Sadly, when you delay EMS activation, every minute increases your risk of lifelong damage or worse. So here's the contrarian truth. Waiting to confirm a heart attack in hopes it will get worse is the most dangerous delay of all. What matters isn't how strong the pain feels, it's how quickly you act on the warning signs your body gives you. In the next section, you'll learn the first exact steps to take the moment you suspect a heart attack, even if you're alone and the symptoms are mild, because that's where survival begins. Let me be very clear with you right now. What you do in the first 5 minutes of a heart attack matters more than anything else. Not your strength, not your age, not your past health, your actions. And this is especially true if you're alone. I've seen this again and again in my years as a heart specialist. 2 people, same age, same symptoms. One survives with little damage. The other loses a large part of their heart muscle. The difference? What they did first. So let's talk about exactly what to do. Life-saving action 1. Call emergency services immediately. The mistake I see most often, seniors wait. They sit down. They hope it passes. They don't want to make a fuss. That delay is deadly. The American Heart Association is very clear on this. Calling emergency services immediately is the single most important step in surviving a heart attack. Not driving yourself, not calling a neighbor first. Calling emergency services. Why? Because paramedics can begin treatment before you reach the hospital. They monitor your heart rhythm. They give oxygen if needed. They alert the cardiac team so treatment is ready the second you arrive. Think about this for a moment. Driving yourself delays treatment. Waiting for a family member delays treatment. Emergency responders save lives because they bring the hospital to you. Here's exactly what to do. Pick up the phone. Dial emergency services. Put the phone on speaker. Say clearly, "I think I'm having a heart attack. I am alone." Even if you are not sure, even if the pain is mild, even if you feel embarrassed. Most doctors won't tell you this, but we would rather evaluate 10 false alarms than miss one real heart attack. This is what makes the difference. Life-saving action 2. Chew 1 aspirin only if safe for you. Now here's where it gets interesting. If you are not allergic to aspirin and you have no history of serious bleeding or stomach ulcers, the American Heart Association recommends chewing 1 regular-strength aspirin, 325 milligrams, as soon as a heart attack is suspected. Chew it. Don't swallow it whole. Why chewing matters. Chewing allows aspirin to enter your bloodstream faster. Aspirin helps slow clot growth in the coronary arteries. It does not remove the blockage, but it can limit how much damage occurs while help is on the way. This is critical. Let me repeat this clearly for safety. Dose: 325 milligrams aspirin. Form: chewed. Timing: immediately after calling emergency services. If you are allergic to aspirin, skip this step. If you have been told never to take aspirin due to bleeding risk, skip this step. Do not take more than one dose. The science behind this is well established. Multiple large emergency medicine studies show that early aspirin use significantly reduces mortality during acute heart attacks. Even at 70, 80, or beyond, this single tablet can buy you time. Life-saving action 3, unlock your door and sit safely. Now, here's what nobody talks about. Heart attacks can cause sudden loss of consciousness. Your blood pressure can drop. Dangerous heart rhythms can appear without warning. If responders cannot get inside quickly, precious minutes are lost. So here's exactly what to do after calling emergency services. Unlock your front door. Unlock any security door. Sit down immediately. Do not lie flat. Sitting upright or slightly reclined reduces strain on the heart and helps breathing. Choose a safe location. A sturdy chair. A couch with back support. Near the front door if possible. This is not about comfort. This is about survival logistics. I've seen cases where responders arrived quickly but lost valuable minutes trying to enter a locked home. Those minutes matter. Think of it like this. You are preparing the runway for help to land. The deadly myth, I'll just lie down and rest. I need to stop you right here. Lying flat during a heart attack can worsen breathing and increase heart strain. Resting without calling for help allows the blockage to continue damaging your heart muscle. Heart attacks do not work themselves out. They progress. This is why standard advice fails. It assumes someone else is watching you. It assumes severe pain. It assumes you'll know when it's serious. But when you're alone, you need a different plan. And now that you understand the first 3 life-saving actions, the next steps become even more powerful. Now listen carefully. This next part is where many seniors accidentally make things worse, even after they've done the right things already. I want you to stay with me here because these 2 actions directly affect how hard your heart has to work while it's under attack. And when your heart is struggling, less strain means more survival. Life-saving action 4. Use controlled breathing to reduce heart strain. When a heart attack starts, your body goes into panic mode. Your breathing becomes fast and shallow. Your heart rate rises. Blood pressure spikes. That reaction is natural, but it's dangerous. Here's why this matters. Scientific studies in emergency cardiology show that rapid, shallow breathing increases oxygen demand and heart workload exactly when your heart can least afford it. In simple terms, panic makes your heart work harder when it's already being starved of oxygen. This is where controlled breathing becomes life-saving. Here's exactly what to do. Inhale slowly through your nose for 4 seconds. Hold gently for 2 seconds. Exhale slowly through your mouth for 6 seconds. Repeat continuously. This is not meditation. This is physiology. Slow breathing helps lower heart rate, stabilize blood pressure, and reduce oxygen demand on the heart. The American Heart Association recognizes controlled breathing as a supportive strategy during cardiac distress to reduce sympathetic nervous system overload. Think of it like this. You are taking your foot off the accelerator while the engine is overheating. I know this sounds simple, but I've seen patients stabilize themselves just enough with controlled breathing to stay conscious until help arrived. Even at 80, even at 85, this still works. The dangerous myth: cough hard to survive. Now here's what nobody talks about, and this is critical. You may have heard advice floating around the internet about cough CPR, the idea that coughing hard can save you during a heart attack. That advice is dangerous for people at home. Major cardiology organizations, including the American Heart Association, have clearly stated that coughing does not treat a heart attack and should not be relied on outside of monitored hospital settings. Coughing increases chest pressure and heart workload. If you're alone, it can worsen symptoms, increase dizziness, and raise the risk of collapse. So let me say this clearly. Do not cough forcefully. Sit, breathe slowly, stay calm. This is what makes the difference. Life-saving action 5. Do not lie flat. Position your body correctly. Now here's another mistake I see far too often. When seniors feel weak or dizzy, they lie flat on the floor or bed. That feels natural, but during a heart attack, lying flat can worsen breathing and increase strain on the heart. The Mayo Clinic and emergency care guidelines advise keeping the upper body elevated during cardiac distress whenever possible. Here's exactly what to do. Sit upright or semi-reclined. Support your back with pillows or a firm chair. Keep your head above heart level. This position helps improve breathing, reduce fluid pressure in the lungs, and lower workload on the heart. Think of it like gravity assisting your circulation instead of fighting it. If you feel faint, lean back slightly, but avoid lying completely flat unless emergency services instruct you to do so. Again, this is not about comfort, this is about survival. Why these steps matter to your independence. I want you to understand something important. Surviving a heart attack isn't just about staying alive. It's about how much heart function you keep afterward. Delayed care and excessive heart strain lead to larger areas of damage. Larger damage leads to fatigue, breathlessness, and dependence. That's how seniors lose confidence. That's how independence slips away. The research is very clear. Reducing heart workload during the acute phase improves outcomes and recovery potential. This is why these steps exist, not because they're dramatic, but because they work. Now, here's the part almost nobody prepares for, and it's one of the biggest reasons seniors don't survive heart attacks when they're alone. You can do everything right medically. Call for help, take aspirin if safe, sit properly, breathe correctly. But if emergency responders can't understand your situation quickly, you lose time again. And time, as you now know, is heart muscle. Life-saving action number 6, stay on the line and follow dispatcher instructions. Once you call emergency services, do not hang up unless told to do so. This is critical. According to American Heart Association emergency response guidelines, dispatchers are trained to guide you step by step through the most life-preserving actions until help arrives.
They listen to your breathing. They assess your consciousness. They prepare responders before they even reach your door. This improves survival. American Heart Association Emergency Cardiovascular Care. Here's exactly what to do. Put the phone on speaker. Keep it close to your mouth. Answer questions clearly and slowly. If you feel weaker, tell them immediately. If your breathing changes, tell them immediately. If pain spreads to your jaw, arm, or back, tell them immediately. Now here's something most seniors don't realize. If you lose consciousness while on the line, dispatchers know immediately. They can upgrade response urgency and prepare for advanced life support. That alone can save minutes, and minutes save lives. NIH Emergency Cardiac Response Data. Think of the dispatcher as your lifeline, not a formality, a lifeline. Life-saving action number 7. Keep your body still. Do not walk around. This next one surprises many people. When symptoms start, seniors often pace. They walk. They try to shake it off. That instinct is understandable, but dangerous. Walking increases heart rate and oxygen demand. During a heart attack, that added strain can worsen heart muscle damage and increase the risk of collapse. Mayo Clinic, Heart Attack First Aid. Here's exactly what to do instead. Sit still. Keep your upper body supported. Keep your feet on the floor. Avoid unnecessary movement. If you need something nearby, your phone, your medication list, ask the dispatcher what to do before moving. Most doctors won't tell you this, but staying still can be as important as medication during the early minutes of a heart attack. Even at 80, even at 85, this still applies. Now the part that can save your life before any heart attack ever starts. This is where it gets interesting. There is one simple preparation step that dramatically improves outcomes for seniors who live alone, and almost nobody does it. It's called an emergency information setup. Emergency physicians and first responders consistently report better outcomes when accurate medical information is immediately available. National Institutes of Health, Emergency Medicine Studies. Here's exactly what to prepare, starting today. 1. A written emergency card. Place it near your phone or front door. Include full name, age, current medications with doses, allergies, especially aspirin or blood thinners, major conditions, heart disease, diabetes, stroke history, emergency contact number. 2. A visible medication list, not hidden in a drawer, visible, clear, updated. This prevents medication errors and speeds treatment decisions. 3. A charged phone, always. Low battery during a heart emergency is not a small problem. It's a serious risk. Charge your phone every night. Keep it within reach during the day. Why this preparation protects your independence. I want you to understand why this matters emotionally, not just medically. Survival alone is not the goal. The real goal is surviving with your independence intact. Delayed treatment leads to larger heart damage, chronic fatigue, breathlessness with simple tasks, and fear of being alone. That's how confident, independent seniors become cautious and dependent. The American Heart Association is very clear on this. Early, organized response improves not only survival, but long-term quality of life. This is what makes the difference. You're not overreacting. You're prepared. Some seniors worry about overreacting. Let me say this plainly. Prepared action is not panic. Prepared action is wisdom. I've seen hundreds of patients who survived because they acted early, even when symptoms felt mild, and I've seen the opposite when people waited. This is not about fear. This is about control. You're doing the right thing by paying attention to every second of this advice. And now let's anchor everything we've covered in real scientific evidence, not myths, not hearsay, but guidelines and research used by emergency doctors and cardiologists around the world.
First, let's talk about the science behind calling emergency services immediately. Major health institutions like the Mayo Clinic and American Heart Association start every heart attack protocol with the same step. Call emergency medical help as soon as symptoms begin, even if you're unsure. The reason is this. Heart attacks are classified medically as acute myocardial infarction, meaning part of the heart muscle is dying due to lack of blood flow. Emergency responders don't just transport you. They begin care the moment they arrive and communicate with the hospital to prepare your treatment team. This early activation is proven to improve survival because time equals saved heart muscle. Now let's talk about aspirin, one of the simplest yet most scientifically supported interventions. The American Heart Association and emergency care guidelines recommend that when a heart attack is suspected and it's safe for you, chewing one aspirin, 162 to 325 milligrams, early can help limit the clot that's blocking blood flow to your heart. This is backed by data from large studies such as the International Studies of Infarction Survival, which showed that patients given aspirin early had significantly better survival outcomes compared to those who did not. The advantage isn't small. Early aspirin reduces clot growth, which in turn reduces the size of the heart muscle that dies during the event. A study published in the Journal of the American Heart Association suggests that early aspirin within the first 4 hours of chest pain onset could save thousands of lives annually simply because it stops the clot from worsening while help is on the way. What about positioning and breathing? Emergency response education from institutions like Mayo Clinic notes that keeping the upper body elevated and minimizing exertion reduces strain on a heart that's already compromised by lack of oxygen. All of these components, early EMS activation, appropriate aspirin use, controlled positioning, and minimized movement, are not just good ideas. They are consistent with evidence-based practices outlined in global cardiac care guidelines used by clinicians every day. Most importantly, every minute counts. Research shows that delays in treatment correlate directly with more heart damage, higher complications, and poorer long-term survival. The sooner you act, the better your chance of preserving heart function and independence. Let's take a calm breath together. You've just learned information that most seniors never hear until it's too late, and I want to make sure this stays with you because knowing these steps and remembering them can truly save your life. So let's recap exactly what to do if a heart attack starts and you're alone. First, Call emergency services immediately. Not later, not after waiting, the moment you suspect something is wrong. The American Heart Association is very clear on this. Early emergency response saves heart muscle and lives. Minutes matter. Second, chew one 325 milligram aspirin only if you are not allergic and have no bleeding restrictions. Chewing allows faster absorption and can slow clot growth while help is on the way. This step is backed by decades of emergency cardiac research. Third, unlock your door and sit safely. Prepare the way for help to reach you quickly. Sit upright or slightly reclined. Do not lie flat unless instructed. This reduces strain on your heart and helps breathing. Fourth, control your breathing. Slow it down. 4 seconds in, 6 seconds out. This reduces heart workload and keeps oxygen demand lower during a critical moment. Fifth, do not pace, walk around, or cough forcefully. These actions increase strain on an already stressed heart. Staying still is protective. This guidance is supported by emergency care recommendations from major medical institutions. Sixth, stay on the line with the emergency dispatcher. Keep your phone on speaker. Answer clearly. Dispatchers are trained to guide you through life-saving steps and adjust urgency response in real time. And seventh, prepare in advance. A visible medication list, an emergency card, a charged phone. These simple steps improve treatment speed and reduce dangerous delays. Emergency medicine studies consistently show better outcomes when responders have accurate information immediately. Now, here's the most important message I want to leave you with. You are not overreacting by acting early. You are not weak for calling for help. You are being smart. You are being prepared. Even at 70, even at 80, even beyond, you can still protect your heart. You can still protect your independence. I've seen seniors survive because they remembered just one of these steps, and I've seen others struggle because they waited, hoping symptoms would pass. The difference wasn't luck, it was action. So here's exactly what I want you to do today. Write down these steps. Keep them near your phone. Share this video with someone you care about, because one day this information may protect not only you, but someone you love. If this video helped you, support this channel by liking and subscribing. It helps us reach more seniors who need clear, honest health guidance. And in the next video, I'll explain how to recognize early heart warning signs weeks before a major event, something most people completely miss. Stay with me, stay prepared. And remember, this knowledge gives you control.